Hello everybody, I am Dr. Suboor, Consultant Medical and Oncologist at Kaizen Hematology Oncology Network, Hyderabad. So in this video, I thought I would answer some of the frequently asked questions that are posed by my patients, be it through WhatsApp or face-to-face. So the first question that I commonly come across among my patients is that, are all cancers hereditary? Answer to this is no. Only about 10 to 15% of cancers are hereditary. That too, some of breast cancers, ovarian cancers, and prostate cancers, and to some extent colon cancers can be hereditary, but majority of the cancers are not hereditary, which means they are not related to genetics or family history. The next question is, a patient or a patient's family members, they come and ask me, if I do not have a family history, am I safe from cancer? Again, the answer to this is no, because as I mentioned earlier, just about 10 to 15% of patients have a family history of cancer. 80 to 90% of the patients do not have a family history of cancer, and they still get cancer because cancer is a multifactorial disease. It is not related only to genetics. So if a patient does not have a family history, it doesn't mean that he or she is safe from cancer. The next question is cancer restricted to certain age groups? Well, cancer is not restricted to any specific age group, and there are different types of cancers that can affect different age groups. I will give you an example. Among children and adolescents, blood cancers and brain tumors are commonly occurring, whereas in elderly we have certain different types of blood cancers such as acute myeloid leukemia or myelodysplastic syndrome. Similarly, ovarian cancer can occur in the 5th or 6th decade, breast cancer can occur in 4th or 5th decade. So on and so forth. Different types of cancer affect different age group of patients, and no age group is safe or completely risk-free from cancer, because we are seeing patients as young as even a year or 2 years also who are suffering from cancers such as leukemia or nephroblastoma or a neuroblastoma. Another question that I frequently come across is that a patient comes and asks me, sir, I do not have any habits such as cigarette smoking or alcohol. Am I free from cancer? Well, cigarette smoking and alcohol can attribute to a good number of cancers, but patients who do not have these addictions or any other habits such as gutka chewing or any alcohol intake, they still can develop cancer. Especially we come across this among female patients who do not have these habits such as alcohol intake or tobacco chewing. They are still suffering from cancers such as lung cancer or liver or breast cancer. So there are multifactorial reasons for such type of cancers occurring. All of them need not be attributable to tobacco or alcohol. So if someone does not have these habits, doesn't mean that they will not get cancer. They are still at risk of cancer, and only way to prevent is regular health checkups. The next question is pretty interesting. A patient's family member or an attender, they come and ask me, sir, I have a family member with cancer. Can I eat food with them? Can I share my food with them? Or can I sit with them? Well, the answer to this is that cancer is not a communicable disease. It doesn't spread from one person to other through contact. So a cancer patient can lead a normal life. They can eat with their family members, they can share their food with their family members, they can sit with them, they can play with the kids. Now the only thing to be kept in mind is that if a family member of a cancer patient has some infection such as cold, cough or a viral infection, they have to stay away from that cancer patient, because the cancer patient has low immunity. They can get that infection from that particular family member easily. For that reason, we avoid asking the patients to have any family member who has these symptoms such as cold, cough or a viral infection. They should be staying away from that. Apart from this, there is no special restriction in social mingling or even going out. Are there any dietary restrictions while undergoing treatment for cancer? So this is again a pretty common question that I come across in my practice. A lot of patients do ask this question. Well, the answer to this is that there are no specific restrictions for a cancer patient undergoing chemotherapy. If they are diabetic or if they have hypertension or any coronary artery disease, they have to follow those particular dietary restrictions. For chemotherapy, there are no special dietary restrictions that are required. However, in certain scenarios, such as during the treatment of blood cancers such as leukemias, especially in the initial part of the treatment, the patients are prone to develop a metabolic abnormality called as tumor lysis syndrome. Now, in tumor lysis syndrome, because the cancer cells are getting ruptured, they can release potassium and phosphorus in the blood. So, for that reason, during the initial treatment of leukemia or blood cancers as such, we ask the patient to avoid taking food that is rich in potassium, such as bananas or citrus fruits or coconut water. Barring this, there are no special restrictions while a patient is undergoing chemotherapy for cancer. Another interesting question is that, are there any foods that can prevent cancer? Well, there is no scientifically proven food that can actually prevent cancer. There has been some buzz around turmeric that has some anti-cancer properties which has been claimed, but again, this is not scientifically proven. So we do not have any foods that can actually prevent cancer. However, we recommend our patients and their family members to avoid certain foods such as highly processed foods or foods that are rich in trans fats, which is saturated fatty acids, and foods that are high in salt intake or pickled foods, because these foods are prone for developing certain cancers such as gastric cancer and colon cancer. So avoiding these foods to some extent can reduce the development of some of these cancers, but there are no proven foods that can actually prevent cancer. So on that note, I conclude this video. If you have any other questions, you can always post and contact our team. We would be happy to answer those questions. Thank you.